An epidural is an anesthetic technique that consists of administering medication in the epidural space through a catheter inserted in the lower back. This reduces or eliminates contraction-induced pain by blocking the pain-transmitting nerves. This technique has become very popular with close to 90% of the labor patients at our facility benefiting from an epidural.
Hi there.
Hi.
Looks like your labor's progressing really well. Yeah. How are those contractions feeling?
A lot stronger.
A lot stronger.
Yeah.
Okay, well that's really normal. Your nurse is going to start your IV, and then you can communicate with her and let her know what you might want for pain relief, okay?
Okay.
Once you are admitted to the Family Maternity Center, have a working IV in place, and are confirmed in labor by your midwife or obstetrician, you are eligible for an epidural consultation with an anesthesiologist. Research has shown that epidurals do not prolong labor nor increase the risk of cesarean section or forceps delivery.
You look like you're having a little more pain. How you doing?
They're definitely getting stronger now.
Okay. You doing all right, or do you want to do something different?
I think I might be ready for the epidural.
Okay. We'll get this IV going, and we'll give the anesthesiologist a call.
Okay.
While you may receive an epidural at any point during labor, it is usually best to wait until you are dilated to at least 3 to 4 centimeters to make sure the epidural continues to work well throughout labor and during delivery when the pain is most intense. There are several steps to getting an epidural. Depending on extra lab work that may be needed for various health conditions, the entire process may take anywhere from half an hour to an hour before you feel relief, so it is important to plan accordingly. Just as getting an epidural too early is not ideal, asking for an epidural too late when your cervix is 9 centimeters or completely dilated may not leave enough time to place the epidural and get relief before your baby is born. Once the initial preparation is complete, the labor nurse will page the anesthesiologist. Several additional monitors will also be placed to monitor your blood pressure and heart rate.
Hi there, I'm Dr. Ismail. I'm going to be your anesthesiologist. Nice to meet you.
Hi there.
Nice to meet you as well. So your nurse tells me that you'd like an epidural. She's given me some of your health history. Do you have any questions? How much do you know about an epidural?
I don't know very much. Just
Okay.
what I've read online and what I've heard from my friends.
Okay, sure. Well, there are some risks. Would you like to hear about them?
That'd be good.
Okay, so there are some risks that are quite rare. The first of the few are bleeding and infection. Those are simply there because we're going to be placing a needle through your skin, just like the IV. As far as infection is concerned, it's greatly reduced because we use a disinfectant to clean off your skin. Okay, the risk for a special kind of headache is also there. It's called a spinal headache. It can happen within the first 24 hours after we do the procedure. There are easy ways to treat it, so we would like to know if you have those symptoms. There are risks for nerve damage. Those are very rare because we place the epidural just below where the spinal cord ends. Sometimes also the epidural may not be working as well as we would like, and we have an anesthesiologist in the hospital 24 hours a day to help make that epidural working better for you so we can get it to be perfect. Okay? Do you guys have any questions for me?
Does the medication affect the baby at all?
That's a great question, and no, there are very small amounts of medicine that actually get into your bloodstream so that it doesn't affect the baby. What can happen though sometimes is your blood pressure can drop with the placement of the epidural. That's why we're going to be checking your blood pressure very routinely and very frequently once the procedure is started and afterwards. If there is a drop in your blood pressure, we can give you additional IV fluids and medication to help get it to a normal range.
Okay.
All right. Any other questions?
I don't think so.
Perfect. Well, the nurse will help you get into position, and I'll get set up.
Thank you so much.
Welcome.
Proper positioning is one of the most important parts of getting an epidural quickly and efficiently. The better the positioning, the faster it will be for the anesthesiologist to place the epidural. The anesthesiologist and nurse will guide you into the proper positioning.
Okay, we're going to sit you up and get you in position for the epidural, okay?
Okay.
We're going to swing your legs around and you're going to face out that window. Dad, I'm going to use this chair to put her feet on if that's okay. Okay, so move these here and we're going to go ahead and swing your legs around. Perfect. Get that chair under your feet. So we're going to bring your legs around so that your feet are flat on the chair here, and scooch back so that your inside of your knees are touching the inside of the bed. Makes it easier for her to reach. The position that you take is the most important part of this.
Okay.
You're going to make sure your hips are even, and you're going to do a big slouch with your shoulders and then round your back out so that they can get in between the bones to do your epidural. Okay?
Sure.
So even, big slouch, and around. Perfect.
Is that good?
Just like that.
Okay.
Yeah.
Okay, your position looks great. I'm going to go ahead and let you know what I'm doing every step of the way so there won't be any surprises. The first thing I'm going to do is clean off your back with this cold disinfectant. Okay, 3 times. Here we go. Excellent. One last time. Next is a sticky, sterile drape to help keep everything nice and clean.
Although it usually only takes a few minutes to place the epidural, finding the right spot can take longer depending on the individual patient's anatomy and size.
Can you curl a little bit more around your baby? There you go. That's perfect. Okay, the first part is the most painful part, and it just lasts a few seconds. It's the numbing medicine for your skin. Here we go on the count of 3. 1, 2, 3. Very good. Okay, the next part.
I think I'm having a contraction. Just a minute.
Okay, we'll wait until you're ready to go. Just let me know.
As much as possible, the anesthesiologist will try to work in between contractions. However, there may be certain parts of the procedure where they'll have to continue regardless of a contraction.
Okay.
Okay, go ahead and get back into that position again. Relax your shoulders. Push your back out towards me where you feel my fingers. Great. Okay, the epidural now will feel like a lot of pressure. If you feel anything pokey, let me know. I'll give you some more numbing medicine, okay? All right. Perfect. Great, we're in the right spot. I'm just going to give you some medication now.
I think I'm having another contraction. What do I do?
It's okay. It's okay. Just breathe nice and deep. You can breathe through this contraction. Just hold as still as you can. Nice and still.
And what I'm going to do is go ahead and place that catheter in. We're almost done.
Good job. Nice.
You're doing great. Let me know if you have any ringing in your ears or tingling around your mouth. Anything at all?
No.
Perfect.
I think I have another contraction coming on. So.
Okay, well, all the needle's out. So the next thing I have to do is just tape it down and we're ready to go, okay?
Once the epidural location is verified, the anesthesiologist will give an additional dose of medication to get you comfortable. Roughly 5 to 10 minutes after this dose of medication, you will feel your legs getting warm and tingly. Usually around 15 minutes to 20 minutes later, you will feel your contractions get shorter and then less intense. It is normal with a working epidural to still feel pressure when having contractions.
So this catheter is very flexible, as you can see here.
The anesthesiologist will connect the epidural catheter to a pump that administers a continuous dose of medication throughout the duration of your labor and delivery.
Lying on it, moving around is not going to kink it or affect it in any way, okay? And as the baby starts to move down into the pelvis, you'll start to have some more pain in areas where the epidural wasn't necessarily working as well before. So for that reason, we have some more medication that you can give to yourself. You'll have a little button that you can push. You can't give yourself too much. It will only allow you one button push every 10 minutes, so that there's no risk for an overdose. Just let us know if you're not getting comfortable, though, because the nurse can then call me and I can help you get it set up. Okay? All right?
Sounds good.
How was that last contraction?
I didn't feel it as much.
Excellent. Good.
Yeah.
All right.
Thank you.
In rare cases, in which an epidural continues to not work well, it may need to be replaced. Proper positioning in bed after epidural placement is also important to make sure the medication is distributed evenly to both sides. You will have to remain in bed after receiving your epidural, as your legs may be weak and you will be at high risk for falling if you try to walk. You will also not be allowed to eat or drink anything other than ice chips or a popsicle until the epidural catheter is removed. Once you are comfortable, the labor nurse will place a bladder catheter to drain your urine, as you will not be able to get up to go to the bathroom. If for any reason during your labor you need a cesarean section, the epidural may be used if it is working well. If not, it will be removed and a spinal or general anesthetic technique will be used instead for the surgery.